Voces UTRGV interview question script with Mr. Hector Saenz. UTRGV preamble Voces of a pandemic. Hello, today is April 10th, 2021. My name is Marisol Lozano and I'm interviewing Hector Saenz for the University Library Special Collections and Archives at the University of Texas, Rio Grande Valley, hereafter abbreviated as UTRGV. This project is in partnership with the Voces of Oral History Center at the University of Texas of Austin. Please know, Mr. Saenz, that this interview will be placed in the University Library Special Collections and Archives at the UTRGV and shared with Voces Oral History Center at the University of Texas at Austin. If there is anything you do not wish to answer or talk about, I will honor your wishes. Also, if there's something that you want to talk about, please bring it up and we'll talk about it. The University Library Special Collections and Archives will archive your interview along with other photographs and other documentation you're willing to share. UTRGV University Library will retain copyright or non-exclusive rights to the interview and any other materials you donate to Special Collections and Archives at UTRGV. Because we are not conducting this interview in person, I need to record you consenting to make sure you agree with our interview procedures before we continue. So I'm going to ask you a series of 6 questions, and please say yes, I agree, or no, I do not agree after each question. The first question is, do you give University Library Special Collections and Archives at UTRGV consent to archive your interview and your materials at the UTRGV University Library?
Yes, I agree.
Yes, okay, thank you. The second one is, do you grant UTRGV University Library Special Collections and Archives right, title, and interest in copyright over the interview and any materials you provide?
Yes, I agree.
And then the third one is, do you agree to follow UTRGV University Library Special Collections and Archives to post this interview on the internet where it may be viewed by people around the world?
Yes, I agree.
All right. Do you grant the University Library Special Collections and Archives consent to share your Zoom interview with the Voces Oral History Center at the University of Texas at Austin for inclusion in the Voces of a Pandemic Oral History mini project, which will include posting the interview on the internet?
Yes, I agree.
So, as you recall, we previously filled out our pre-interview form. We use this information from the pre-interview form to help in research. The entire form is kept in a secure Voces server at the University of Texas at Austin. Before Voces sends it to UTRGV University Library Special Collections and Archives, we would have stripped out any contact information for yourself or your family members. So that will not be part of your public file. Your public file will only be accessible to the UTRGV library. And then the final 2 questions for your consent on what I just described. Do you wish for us to share the rest of your interview in your public file available to researchers at the UTRGV University Library Special Collections and Archives?
Yes, I agree.
Okay. Our final question is, on occasion, UTRGV Special Collections and Archives and Voces receive requests from journalists who wish to contact our interview subjects. We only deal with legitimate news outlets. Do you consent for us to share your phone numbers, email with journalists?
Yes, I agree.
Yes, okay. Thank you for your consent. Your experiences and stories mean a lot to us at UTRGV Special Collections and Archives. I look forward to what you say in our interview questions. I will now ask. So, Mr. Saenz, thank you for your time. As previously stated, your stories and experiences are valuable to us at UTRGV Special Collections and Archives and the Voces project. At the UTRGV Special Collections, we are committed to preserving the stories of Mexican Americans and Latinos from South Texas and the Rio Grande Valley, and those who work closely with those populations during the pandemic. Because you are a secondary special education high school teacher who cares for his students' physical and mental health, mental well-being in the Rio Grande City community, and because you are a son and a husband and a father who has a personal story of the ways COVID-19 has affected others in your inner circle, and personally, I know that you have a meaningful COVID story and experience. to share on how COVID-19 has impacted your role in your daily, personal, and professional life. And so, before we get into your encounters with COVID-19, I just wanted to get a little bit more personal and kind of get to know you. So could you kind of share a background on who you are and your history, like where you grew up?
Thank you, Marisol, for having me here. As you said, my name is Hector Saenz. I'm a resident of Organic City. I'm 54 years old. I'm a special education teacher. Uh, I believe, been a teacher for about maybe 26 plus years, give or take. I'm a third, maybe fourth generation rancher. I like hunting, fishing, and riding my horses. Okay, here at the ranch, as well as the freedom of riding my motorcycle. That's one of my biggest hobbies is riding my motorcycle. Okay, there's nothing like the open road and the wind in your face.
So
Uh,
since sorry, since you're a rancher, do you think that that's like affected the way has COVID-19 affected you in any way?
the Not so much because we're pretty much isolated from everybody from town. However, we really can't compete with all these bigger ranches that have the beef and stuff like that, to sell. For me, it's just more like a hobby, something that my grandfather and my mom and my father, left us. And I try to continue that tradition. So as far as the COVID situation for me, I really don't think it affected me that much here at the ranch, though.
Um, so do you think that because you are isolated in a ranch that it kind of in some ways helped prepare you for the quarantine of the pandemic?
I believe so. We were hearing about this since back in December 2019 when it hit China and it started spreading throughout the parts of Europe and China and whatnot. Uh, I really didn't think it was going to get to this point. Um, and being isolated kind of helped us a bit. We just kind of prepared ourselves mentally. But it is what it is.
So your kind of your isolation and the you already kind of like somewhat preparing or knowing for it leads me to like my next questions about your first encounters. So because this is for the Voices of the Pandemic project, I want to begin by focusing on your primary experience with the pandemic and its start. Uh, when did you first hear about it, and how did you feel about this pandemic since we haven't gone through one in a while?
Well, I think we first heard about it of COVID, about COVID-19 through the newscast on Channel 5. Sometime back, like I said, sometime back in December 2019 when it first started breaking out up in China. Um, but like I said, I really didn't think it was gonna get to the point where it is right now.
So did you ever since because it is like there's a lot of life altering events, at what point did you kind of realize that this was something serious and how it's affecting America and really the world?
Um, yeah, once the first couple of outbreaks or cases started popping up here in our valley, I kind of figured, okay, now we're in for something big. It's going to be life changing. Not just for me, but for every one of us. I still was a little hesitant on the impact, but it did hit.
Was your family just as like, did they feel the same way about the pandemic, or did they feel like differently about it?
Yeah, we, like I said, we really didn't think it was going to get here, but once the cases started, springing up in the valley, we kind of looked at each other, my wife and I, and we talked about it. And I said, you know what, this is gonna, it's gonna hit home. It's going to hit home sooner or later. It's going to hit home, and it has, you know.
And how do you feel since, because it did hit you personally and it has affected you. How do you feel kind of thinking about it from the beginning of the pandemic where you kind of believe that it wasn't going to come to the valley, but then, it did and it did have an effect on you?
Well, it's kind of hard to deal with something like this because you don't know the magnitude of it until it really hits home, you know. And we were my wife and I were just glued to the news to see, what was happening, what was going on, and but we were scared, we were concerned, because of my father and all these and my mother-in-law as well, who were up in age. But we just kind of, thought it through and figured out, okay, well, hopefully this is the precautions that the CDC is saying for us to follow. So we kind of pretty much followed that.
And how did you kind of deal with it or like help your mother-in-law with it?
Well, pretty much just not being with her as much and being not being around my dad as much. Well, for me, being around my dad, I mean, that was a given. We had to be there for him here at home. Pero as far as going out to town, going to public places, having our face coverings, washing our hands, distancing ourselves from other individuals. That's pretty much how we came about it. And we were lucky enough, fortunate enough to fly under the radar, so to speak, from not catching this thing.
And how do you think that the Valley or really Rio Grande City kind of dealt with the pandemic? Do you think that they kind of the people or were kind of like all right with it and they, followed the guidelines, or do you think that some of them kind of just didn't care about it?
I think that the first couple when we had those restrictions or those isolations and whatnot, to stay put, stay in shelter in place situation. That's when the people started finding out, oh, okay, this is real. This is happening. So they pretty much, were doing all right. But then I remember back, Memorial Day rolls around, or one of those days where those celebrations back in May of 2020. That's when more spikes and the COVID started popping up. So they dropped their guard a little bit, but then they started getting back on track and started reducing those cases.
Yeah. So for these next set of questions, I'm going to kind of move on to like the personal impacts. So I'd like to talk about how COVID-19 has personally affected your family and, yourself in terms of your professional and personal life, because you did lose your dad to COVID-19. And, it was a death that's different from the ones pre the pandemic, and having family members that lost their jobs due to the pandemic and, two other family members who are considered frontline workers. So Mr. Saenz, let's talk about your family life before the pandemic. What are some of your family activities that you guys, would do before the pandemic happened and quarantine?
Yeah, pretty much. We would have gatherings, every weekend or every other weekend. We have a little barbecue here at home, or we would visit our mother-in-law, and we would just be with her. My wife loves playing bingo, so all that pretty much came to a halt after all this came about. So we pretty much not would not see everyone, even including my sister. Also, we would just call each other up. But yeah, that's how much that's what we did. It all our family gatherings were pretty much come to a halt.
And so, because you, from the pre-interview and, the way that you speak about your family, you are kind of a very family-oriented man. And so how did the pandemic impact your family traditions? Like holidays and birthdays, especially since, we did just have Christmas and Thanksgiving. Did you have like a traditional Thanksgiving or did anything change?
Yeah, no, Thanksgiving was just very minimal. Just our immediate family, my boys, my wife, my daughter. Not I wasn't even being able to see my sister at all. Also, so we just kept it down to the bare minimum. Just the immediate family members within the household.
What was it like celebrating, Thanksgiving, a holiday where you're so used to having all these family members surrounding you to just having a little small, kind of immediate family? How was it different from all the other ones? How did it make you feel?
Well, it was different though. It had a different vibe, a different feel to it. It just made it a little bit more difficult. Not being able to be around with the family members and whatnot. Uh, I guess it would be a little, I don't know, maybe depressing because family members weren't there. And it just made it a little harder.
And so, did you attend any weddings or important events like graduations or funerals? And how did the pandemic make these events different from pre-pandemic times?
Weddings, we didn't go to any weddings or any funerals. We tried not to because of the spikes and COVID situation. But we pretty much try to stay put, here at home, just going out whenever we had to, for groceries and whatnot, and come back to our home.
And so, in our pre-interview, you mentioned that your oldest son lost his job due to the pandemic. Can you share more about his experience with it and how he's holding up and doing now?
Yeah, my son was as a geologist. He graduated from Texas A&M University in College Station. He started working for a company out of Columbine, Colorado, as he's called I can't remember the word he uses. Anyway, he would collect data sample or mud samples, a mud logger. That's the word uh, for the company, and he would get these soil samples and take them into this boss to analyze. But in any case, once this COVID situation hit, he was laid off. And so he came back home. Was laid off for about 6, 7 months. He was a little down. He was down in his luck because here in the valley, you're not going to find jobs in as a geologist anywhere. So you have to go up north somewhere and try to work. But he so far he ended up a job, landed a job up in Colorado with a firm that does environmental work. So he's doing all right at this point.
That's good. So, because he is your son, so how do you feel knowing that he ended up losing his job because of the pandemic? How does it make you as a father who, was so used to taking care of his son, and then his son kind of left your son left you, so he became more independent and he went home and he kind of, had to depend on you. How does it make you as a father knowing that the pandemic did affect you personally in multiple ways?
Well, like I said, I think that my son, is becoming more independent. He's more. It's going to build character for him. Making him a better person because he's able to handle his own. However, as a father, you've got to do what you got to do for your kiddos. For your kids, and you help them out in any way, shape, or form. That's what family's for. Yes, it's hard. It's a little hardening on the individual, but these are rough times, and we just get through it. We talk about it, and we just encourage to do things.
So do you think because of that happening, that it put any like additional stress or pressures on any family members? And can you like describe it?
I think that the stressor was more on him, for my son, for my eldest son, because he was just freshly out of college, out of the university. He had landed his first job. He was making good money, and then all this happened. So yeah, he was a little. I guess he was a little depressed, for a good while. Like I said, there was nothing here that would, in his field that would offer him a job and stuff. So Uh, yeah, it was a little hard on him, pero thanks to God that he was able to land that job up in Colorado, and he's doing really really well now.
That's good. Good for him. And so you also mentioned your youngest working at a pharmacy. How does it feel to have him working at, a pharmacy and doing such an important job during the pandemic? Are you concerned that, he can get sick or because anything can happen to him where he's working?
I'm very proud of both of my boys. Matthew, my youngest, again, he followed his brother to Colorado. He wanted to be, try to go out there and see if he could do it on his own. And he's doing really, really well. He landed a job as a pharmacy tech. Yes, it's a little concerning, that he's there. He might be exposed. But thanks to God, he was able to get his acquire his vaccine. His first dose and then his second dose. So he's doing okay at this point. And I think that with God's will, he'll be okay.
So have your sons ever told you how they feel being affected by the pandemic?
Not really. I think that both of them are just pretty much independent. They do what they want, when they want, and how they want it. So I we do talk about it. Just for them to be safe, be take care. Just make sure that they follow all these rules and whatnot. To take care of themselves. But they're pretty much independent. They don't really. I really don't think they're too concerned about it. It's there in the back of their head. Just nagging at them, but they're pretty much they're okay. They're level headed.
Do you know the guidelines or how Colorado is handling the pandemic over there?
I'm not entirely sure on how the guidelines over there for Colorado is, but I know that it's the same mandate as it's here in Texas on for some of the sites there in Colorado. Their mask, wearing of the face shields, their mask, their social distancing themselves when they're in stores, remain those 6 foot apart and whatnot. That's they do follow CDC guidelines.
Okay. So you also mentioned that your wife is working as a physical therapist assistant. Can you share a little bit of her experience as a frontline worker during the height of the pandemic and how it made you and your family feel, knowing that she, may possibly come in contact with the virus while at work?
Yeah, my wife is a physical therapist. It's scary though for her to be out there, and she's a frontline worker working with pediatrics and adults. Again, they do follow the same guidelines, that is recommended by CDC. The social distancing, the wearing of the mask. They do sometimes they do teleconferencing or telemedicine. But it's hard because this thing really and truly it doesn't discriminate. It affects everybody. So at any given point, she or I could just get exposed. It all takes one instance, and then that's it.
Yeah, and do you think that her workplace is kind of handling the pandemic and the guidelines? Do you think that they're doing things like right and helping protect their workers?
I believe so. I believe that they're taking all the necessary precautions so that they can keep each employee and as well as their patients safe. But like I said, this is something that doesn't discriminate. It's here. This is our reality. But we as individuals, we have to take the initiative to safeguard not just our own, but everyone else that's around us.
So, a lot of Americans did lose their jobs due to the pandemic and they're suffering from the economic downfall due to it. How do you feel knowing that you were one of the lucky ones that were able to keep their jobs and you're able to stay kind of somewhat financially stable as your job as a teacher?
Well, it's unfortunate that some Americans were faced with this economic hardship. We were fortunate enough to have a small savings, you know, and we're able to keep our jobs. We were unaffected, and we try to help out others, our immediate family members and whatnot. with whatever we could that were less fortunate.
Did any of your colleagues or like your friends were they personally affected by like an income or a job loss?
Not in an immediate circle. I mean, other than my son, my oldest, but not anyone in their immediate family, like close to us. No.
All right. So we're gonna get a little bit more kind of, I guess, morose and into the reason, one of the main reasons why I asked you for this interview. So we talked about your dad and the isolation of and having to come to terms with his death. Before we speak on this, can you tell me a bit about your dad and who he was and what are some of your favorite memories of him?
My dad was a very honest and hardworking man. Back in his prime, he would work two or three jobs just to keep the family afloat. It was harder on him, uh, but he was very honest. He taught me many life lessons that I still follow today. And I guess one of the fondest memories that I have of him is when he was riding my horse, and I figured, and I would see him ride my horse, and I thought to myself, you know what? He sits this saddle, there's just something about him when he rides that horse. It was very graceful. He had this, I don't know, I don't know how to say it. It was just, I would like, would love to see him just ride off on the horse. It was very nice. I still have that picture of him riding that horse. He looked very majestic.
Did you because your dad was a very hardworking man. He did work two jobs to keep your family stable and help you guys. Did you kind of learn anything from him and kind of like what you think a man is or like a Latino man is supposed to be? Did you learn anything like that from him? Like kind of, I guess, the right with the proper kind of masculinity, like how to care, how to be a provider for your family.
Oh yes, like I said, he taught me many life lessons. One of them is being honest, and respectful to your wife or your spouse. Also, to be dedicated to your work. It's you do an honest job for an honest pay. And that's something that I pride myself in because I want to follow my dad's footsteps as much as I can. He may have been you know, short in stature, but he was a very tall person. A very tall man to fill those shoes.
So now can you kind of share with me about his illness and his fight with COVID, how like the very beginning of it, of how it all happened?
Dad, my father, you know, suffered from COPD, which is chronic obstructive pulmonary disease, for many years. He was a heavy smoker, and then back in his prime. Unfortunately, all this caught up to him, later in life. Uh, Back in 2019, in December, he got a bout of pneumonia, and he landed himself in the hospital for, I guess, 21 days. Unbeknownst to us that this may have been the beginning of something bigger. We didn't know. But I think that even on his death, he went in with pneumonia, and according to the death certificate, he ended up getting COVID, which I don't think was the case because all of us would have been infected with it at that point in time, but we weren't. You know.
So how does it feel to lose a loved one during this pandemic? Do you think that it's harder during the pandemic, especially considering the hospital regulations and how these patients do die alone? They don't have their family members with them and they're, relying on strangers to care for them until their death. How does it make you feel knowing that you couldn't be with your dad on his last moments?
Uh, it makes me very, very sad and very sick, to my stomach, knowing that my dad was all alone, in a hospital bed with not my sister or myself to be with him. It made it that much harder for him to try to deal with all this on his own. I honestly think that dad just died, you know, knowing that nobody was there for him. He was, I guess, heartbroken, so to speak, and uh, depressed because not a single family member was there. We couldn't go, and if I could change everything, I would have just brought him home and had him be here with us.
Yeah, and because here you're used to being with him every day and kind of caring for him every day, and so it's kind of like the family's um idea, or I guess mission, to take care of their parents when they're older. Once the parents are older and their children are older, how do you think that it made your kids and your your other family feel, knowing that they had to lose someone during the pandemic, and it was a lone death?
It was it's devastating. It's very hard, because you know that you want to help them, but you can't because they won't let you. It was just tough on everybody, and if I knew that they were going to place him in a hospice, I would have brought him home. I wouldn't have left him there. But these people never told us that it was a hospice, and I'm so upset at that. And every time I think about it, it takes me off. But because but we just got to move on, you know.
So do you think that the hospice would have let you take him home?
I believe so. We would have talked to administration, about it. But I think that it would have been possible for him to come home with us. That way he would have done. He would have been here at home. He would have died in peace here at home, knowing that there's family there to be with him and till his last breath.
So if you wish to share, how did the pandemic impact the way you and your family mourned and memorialized your dad at his funeral and his services? How was it for you that you had to go and see your father the way that he was, and know that that is how it happened to him, and that he was alone?
It was hard seeing our dad like that, but there the impact for us there at the funeral home, we were surrounded by a few family members and friends, and they would take turns going in and out of the chapel. Again, all these guidelines were in place. It wasn't a full capacity. They had like maybe like 50 or 25 to 50%, uh, or not percent, but people going into the chapel at a time, and then they would alternate. But it was hard. It was hard on everybody. It was especially hard on my sister, and because she and dad were very close as well, and it was hard on her as well.
And how is your sister handling this? Because like as you said, it was hard for her and they were close. How is it for her?
It's hard. She doesn't speak much about it, but I know that it's hard for her to have gone through all this. She and I tried our best to try to keep them safe and whatnot. But I know it's taking a toll on her as well. I know she cries. She cries on, but I think the only thing that we can do is, move on because that's what he would want for us to do.
So when you were explaining what happened to him, do you think that it's safe to say that maybe there is some partial blame to the hospital for not alerting you guys and telling you like what was going on with him? Do you think that maybe it's kind of safe to assume that he got it from the hospital where he was staying at, or anything like that? Because you said that your family didn't have COVID. So do you think that maybe he kind of got it from there and they just never let you know?
I think there was a number of things. I can't solely say that it was the hospital's, that's where he got it. Because I still to this day think that he didn't have any COVID or anything like that. He had complications of his COPD. And I think what happened to him is that he uh, was affected with pneumonia on both lungs, and that made it that much difficult for him. He turned 89. So for somebody to live that long and try to fight pneumonia, it's pretty hard. I do blame the hospital though, because like I said, if they would have told us that he was that seriously ill, then we would have my sister and I would have made arrangements to bring him back home. But not once did the doctor give us an exact answer to our questions. How is he? I would say, oh, he's fine. Oh, he's doing okay. He's a little bit better. But that better never got better. It got worse, worse, and worse until they moved into a hospice, which my sister and I never knew that it was a hospice. They never told us. And that is my only gripe.
And so do you think that do you like have any kind of guesses as to why they never let it on, like told you anything about him and why they kept telling you that he was fine? Do you think that that's kind of like a bigger problem with the hospitals and how they tend to just keep everything to themselves and right until the last minute when someone's on their deathbed?
I think there was too many patients, too many cases all at once. They were just trying to, try to keep everybody, I guess safe at one point. But in doing so, it affects all those that are not affected by COVID, and they just put them away in like they're just there alone, and that's basically what happens. But yeah, I think that yeah, it was just difficult.
And so this whole situation kind of brings us back to the one of the first questions I had asked you about how, if you had ever thought about the pandemic or COVID-19 coming to you and being a personal story. How does it feel kind of thinking back to when we were first learning about the pandemic and it's kind of overall how it was affecting other people? How does it make you feel now, knowing this, that it's personally affected you?
Well, this is our new reality. This is our new way of life, and as individuals, we have to cope with it and adapt and make changes and overcome. Because if we don't, despite the vaccines and all these things, we can still get it. We can still get sick. But it's up to us. It's up to every individual to make these changes, to be aware of where they're at, who they're with, you know, and who goes to their houses. So this is a very serious illness, and it doesn't discriminate whether you're black, you're white, you're green, you're yellow. It doesn't matter whether you're Catholic or you're Muslim. It affects everyone. It doesn't care.
Yeah, and like, did you have you and your family members, were you guys able to get your vaccines?
Yes, yes, we did. Unfortunately, Mr. Ryan Guillen, our state rep, uh, made some calls and whatnot. He was able to acquire some vaccines for our district, for Stark County, for our teachers, and I guess I believe it's Aroma in our area here in Rio. To get vaccinated, and he was able to acquire the Pfizer vaccine for us. So my wife got vaccinated through her job, and myself through my job through district, and then my nieces also got vaccinated as well. My daughter also, and my boys up in Colorado also.
And so because of your father and everything, how does it make you feel knowing that you that you and your family were able to be protected and get the vaccination? How does it make you feel, kind of like thinking about it, if if only it was able to, he was, the situation were able to be kind of held off for a few more months in kind of regards to him. How does it make you feel?
Can you repeat the question again, please? I didn't quite catch that.
So, like, in regards to you guys, to your family getting their vaccinations and being protected, and so like in regards to your situation with what happened with your father, how does it make you feel knowing that you guys were protected and maybe if only things were able to be like held off with in terms of like your father, how does it make you feel knowing that you guys were safe?
Well, in regards to my father, the vaccines were quite a ways off still. It was too early to get him vaccinated and stuff like that. Uh, how does it make me feel at this point in time? Well, again, I still don't want to let my guard down because I am afraid. You know, like I said, this thing doesn't discriminate. Whether you're vaccinated or not, you can still get it. There's still other variants out there, other variants of this thing. And at any given point, we could just catch it, and then that'll be it.
Yeah, like it's like this morning they put out a some news article about how the you after 6 months you would have to get another vaccine, another dose of your vaccine after like 6 months because then they weren't going to work anymore. So did you learn anything about yourself and your family after the death of your dad that you'd like to share?
I think that not to take life is too short. Don't take anything for granted. Especially the little things like saying I love you to your loved ones. Because you never know when it's going to be the last time you'll see them. And little things like that. That goes a long way.
And so as a final question in regards to your personal life, on your on your hometown, how do you think that town life in Rio Grande City is responding to the pandemic? Do you think the town on the whole is following the CDC recommendations? Because I know that there was a large spike when the pandemic was happening, and a lot of people that the did have COVID-19 were kind of just going to the store and acting like it was no big deal.
I think that our county and our city authorities are doing all they can to protect the community, bring in these vaccines countywide, citywide, to try to get these people inoculated. However, it all goes back to the each individual, to follow these guidelines, wear your protective coverings, social distance yourself whenever, if you're gonna have a gathering, stay outside as much as possible. If you're gonna be inside a room, no more than 5 to 10 people in the room. That way you minimize, the risk of getting infected.
Do you think that people are following the guidelines or they're still kind of just going through this pandemic as like oh, whatever, they're not really like, they don't care about the guidelines anymore, especially since vaccines are making their rounds and they're open to everyone now.
Like I said, it's they're individual persons, that need to do that for themselves because, like they said, you can lead a horse to water, but you can't make them drink. There's people out there that, oh, okay, yeah, I'm not gonna do it. It's okay. We're good. We're vaccinated. We're good. You know, you're gonna have these type of people everywhere you go, whether it's here in our hometown, whether it's up in Houston, Dallas, New York, wherever you go. There's individuals like that. But again, it's up to them to follow these guidelines. If they don't want to, they're not gonna do it.
And so because you do live near South Padre Island, where that's kind of like the spring break hotspot, were you scared of people from Rio Grande going over there and picking something up and then bringing it back to your city? Were you scared of that happening? And maybe, you or your wife coming in contact with someone who did that?
The risk was there, Yes, it's a little it's scary, but like I said, if it's up to them to social distance themselves and whatnot. Um, as far as the spring break is concerned, we just pray to God that it didn't get spikes for because of that. But so far we're doing all right. We're doing okay.
And so I kind of want to move on to more your kind of professional life as a teacher. So your work related challenges. And so these next set of questions are going to focus on your stories and your experience as an educator in the time of COVID-19. You're living in the reality of pandemic era teaching in the Rio Grande Valley, where over 90% of of the population is Hispanic, and a lot of students do come from lower economic brackets. So how do you as an educator compare or react to the digital divide that there is between students, and how your school's response has been to the pandemic? So, what kind of policies did the RGC ISD implement to get ahead of the disease and protect its teachers and students?
All right. Our district before the pandemic and all this stuff. Well, during the pandemic, when we were let out last for spring break last year in 2020, when all this started happening, uh, our district issued out hotspots, Wi-Fi hotspots for all our students, and also allowed for each and every student to go pick up a laptop from our school to go ahead and try to do those assignments, those virtual assignments that were given to our students. We had a what they call a asynchronous schedule that we followed towards the end of the year last year, and then at the beginning of the school year this year, we also went into a synchronous Mondays, Wednesdays, and Fridays, and asynchronous on Tuesdays and Thursdays type of schedule. And it worked out well. Yes, we had issues with connectivity, for whatever reason in different areas. But for all, our district was very instrumental in providing all our students with some type of a tech device.
And so, you as a teacher and with your students, did your students being able to get the hotspots and the laptops, did that kind of help alleviate some of the stress or the worry of your students not being able to do their assignments or learn?
The hardest part of teaching virtually is trying to teach the kids how to connect, how to log into Google Classroom, how to access the assignments. Uh, but I think it was like maybe 2 weeks for practice when doing so before we started getting into the lessons. But overall, they did all right. They did all right.
So, did you have any like struggles with trying to get used to the remote teaching?
Oh, definitely. Teaching virtually is not anywhere remotely similar to teaching face to face. It's a whole different ball game. It changes everything. It changes the way the kids learn because it's more visual, from afar than it is when you're up close and personal. You're doing things hands on. It's just it's a I hate it. I don't like it, but that's something that we have to do, and we have to learn how to adapt to it and overcome. But we as teachers, we have to become innovative.
And so, because you do live in ranch land, do you think that it was harder for you in terms of like connectivity?
Funny you mentioned that. For years, I had been trying to get the fiber optic network to our ranch. And the neighboring ranches by the highway, they were able to get fiber optics. We were the last part of that, uh, I guess, that zone that hadn't had um, fiber optics. So I called them up last, I think it was last March before spring break, and I said, when are we going to get the service? And they said, oh, it's coming, sir. It's coming to your service. I didn't get my service till maybe Before we broke for spring break last year, that's when I got the fiber optics. So with that being said, you know, we got the service a little after, right before spring break. Once that COVID situation hit, I was able to get the fiber optics. We were able to teach, so it made it easier for me to really connect with my kiddos.
How did your students feel about this? Was it easy for them to get used to the remote learning, or did they have any struggles with trying to connect and use Google Classroom? Was it like, were they able to get used to it, or are they still struggling with?
No, like I said, we were able to connect quite quickly, but it's just the process of teaching it because I deal with autistic students and ID students, intellectually disabled. But once you show them, a couple of times, the procedure, how to go, how to access and whatnot, uh, Google Classroom, they're pretty much tech savvy, so they were able to catch on quick.
So because of your students, do you think that maybe do they like the online learning more than being on campus? Do you think that it kind of it's benefiting them, or do you think that it's kind of worse for them?
Well, I think that teaching is virtually, it's just hard for all of us, not just for my students, but also for teachers as well. It's just a different feel. It's never going to be the way it used to be traditionally when you would go into face to face and you would interact with your students, per se. Now it's just the way you're going to do your lessons. You have to do a little bit more research. It's time consuming to look for things that you're going to be able to implement in the classroom while you're there with the kids virtually. So it makes it difficult. It also makes it difficult on them as well because sometimes for whatever reason, technology, sometimes it works, sometimes it doesn't. So they're cutting in and out and whatnot.
So, do you feel like your administration policies and efforts to protect you have been effective? Or do you think that they're just putting these policies up just to like save face? Are your administrators or, like your other teachers, are they being serious about this, or are they kind of just acting like the pandemic's kind of a whatever to them?
No, no, I know that at our campus, we're taking all strides, or our principal is taking every stride, to keep us safe as much as possible. He's put up those plexiglass barriers on the teacher desk and student desk also. We put in these desks that are 6 feet apart with their barriers as well, their face masks, their shields, their hand sanitizers. I know that at the end of the day, they go in and they spray the classes with some mist to disinfect the classrooms. And if someone is in contact with another individual that may have come was infected or whatever, they notify the family members, they notify us quickly, and then they take measures right then and there.
And so, what's that like, the kind of having to be separated from your students and not having that close interaction with them? Because your job does kind of rely on that one-to-one interaction with your students. How's that like for you and your students?
I've got a total of 15 students in my classroom. In my classroom at this point in time, I only have two of them that are showing up to class face to face. Everyone else is at home virtually. It's difficult because you want to do that interaction like we had before, but it's a little harder. But I mean, like I said, we adapt and we overcome. I mean, that's one thing that we have to do. Just keep moving forward, and hopefully this whole thing will end soon, and we'll be okay. But we'll see.
So, are you concerned about the effectiveness of remote learning for educating your students?
Definitely, there is a concern because there we can teach the content. However, it's not going to be the same. It'll never be the same if it would be face-to-face instruction. So there's going to be gaps in learning, because what works for one student may not work for another one that's virtually. You know, it all students learn in different ways. Some learn visually, some learn by using their hands, others learn by auditory. So you have to, as a teacher, you have to tap into every single one of these uh, ways of learning. And if we don't do that, then obviously we're not going to get that learning to 100%. But it is what we have, and yes, it is going to affect everyone at one point.
And so, since you are a special education teacher, how do you think that it's harder for your students with special needs as opposed to those able-bodied students? Like, how do you think this remote learning and not being able to have that one-to-one interaction with you is?
I think that it's affected everyone, not just my kiddos. It's affected every single one of the students out there, in the district. Uh, like I said, it's just a different way of learning, a different way of teaching, and sometimes, like I said, sometimes technology works, and then sometimes at any given moment, it's going to go out. We've had a couple of power outages during our school time this last week, so it affects everybody, you know. And like I said, my kiddos for the most part are pretty tech savvy. Once you teach them, how to log in, how to do it, and they can pretty much figure it out on their own. So I'm very proud of my kiddos.
And so Rio Grande was affected by the winter freeze during your, well, during your school week. How was that like trying to do that remote teaching, but then you didn't have electricity or water or internet? What was that like for you and for your students? How did you feel?
For me, here at home, we weren't not really impacted that much by the freeze. We had water, we had light, we had the heat. For some of my kiddos that were out on maybe like the east side of town that were affected, uh, if they could, they would call me up and say, "Sir, I can't log in." So you don't worry about it. We'll catch up hopefully tomorrow, and that's how we keep in touch. But it was hard for them. It was hard for those that couldn't connect, But their parents were very instrumental in contacting me, letting me know that we just can't log in at this point. So uh, again, our district made a uh, was made aware of the situation, and they made a exceptions to the teaching to the kiddos and assignments that were given and all that. So they made allowances for most of our kiddos.
And so what was that like having to deal with this historic winter freeze, but yet also having that kind of underlying uh, pandemic, COVID-19? How was that for you, having to deal with both of these problems?
Like I mentioned, for me, it wasn't too concerning because like I said, I had the light and the water and the heat and all that. For some of my kiddos that couldn't do it, I would make contact with my parents pretty much on a daily basis to see how they were doing, if they needed anything and whatnot. But it was a scary situation for a little while. But after 2 or 3 days of them not having any water or connectivity or light, you know, uh, and then when everything just came back up, they were able to connect and log in. So everything was good.
So, since in the pre-interview, you talked about how you are a social skills teacher, and this job does mainly entail and benefit from you and your students' in-person interactions. Do you find it harder to teach them the skills that they need because of, you're doing online and you have to, and the ones that are in your classroom, you have to be separated from one another?
Definitely, part of my job is to teach this students the skills that they need for them to be able to be employed in our community or anywhere. And it makes it difficult because you can't take them to a work site, and teach them. We can't do that anymore. So to teach these soft skills, the communication skills, the asking for directions and following directions and all this. It's hard to teach all these little skills that go with being employed. It's just hard.
Can you share some of the drawbacks for online learning in terms of how effective your course is now that it's become remote, and in terms of the interactions, the social skills, and the interactions that the students need?
I'm sorry. Can you repeat that?
Um, yeah. So, can you share some of the drawbacks for online learning in terms of how effective your course is now that it's been become remote, like for you and for your students, in terms of the trying to teach them the social skills?
Well, for like I said, for me, I have my kiddos a whole entire day. It's a self-contained classroom, and we go through our morning routine. You know, we do math in the mornings. We talk about uh, the money matters and the dollars and cents. You know, why it's important to have a savings and whatnot. As far as the employability skills that are associated with the classroom, that's a little bit more difficult because these are hands-on classes, and I can't do that. I can't tell him, can't say, you know what, we're gonna go in and clean our tables. So what I do is say, okay, if we did this last year at the cafeteria, then the exact same thing what we're doing there, I want you to do it at home. You want for you to go and wipe down the table, put away your dishes, clean your dishes, do it this way. You know, so it's a little harder because do they really do it? Once the camera's off, you don't know, you know?
And so, since there is that digital divide in terms of people having internet access and others not having internet, especially in the that rural area where you do live. Did your students have any difficulty in terms of internet access, or did they really benefit from the hotspot?
They benefited with the hotspot as much as they could. However, uh, there were some students who ran out of, I guess you call it gigabytes, because they switched companies in the middle of this whole thing. And so they weren't able to connect because the limit on their hotspot was already out. So they had to take back that tech device and get another one and start connecting again.
So, the pandemic has kind of acted like this social spotlight that's shown all the different social inequalities that are largely based on economic and race-based statuses. And you do work and you do live in one of the poorest counties in Texas, and with Latino students who do mainly come from lower economic backgrounds. When remote learning became a thing, did you have any worries with how your students were going to get by?
Well, a little bit because, like I said, some of these kiddos live in Mexico, you know, and they were sent. They when all this started hitting, they some of them went back to Mexico, and to come and try to connect with them over there to get things going for them was a little difficult. But you know, they were able to get through and get by. Like I said, all of my 15 students are able to access the internet and access my classroom without any issues. And even the ones that are very slow in terms of accessing the classroom or the curriculum, they were able to do so.
So, because I don't really know a lot about this, or I guess in terms of like the special education, how do you go about telling your students about what was happening? Did they already know about the pandemic, or was it something that you had to tell them about, and then, kind of tell them about the severity of everything that was happening?
We would have class discussions, and I would tell them, you know, we were so glued the first couple of weeks when this whole pandemic started going up. We were glued to the TVs and learning about this whole situation, and we would have class discussions. You know, what if it would get here to the valley? What if it spreads, you know, overseas and comes back to us over here in the states? You know, this is still a long ways out. You know, when we started talking about this, but now that it's here, you know, it's like okay, but they've learned to adapt. they've learned to deal with it, and the parents are also very instrumental in helping me with that as well, to try to explain to them. It makes it that much easier for me to talk to them and stuff.
Yeah, and so how do your students feel about it, like from the beginning, and how do they feel about it now? Like especially the ones that do live in Mexico and everything. How is it for them? Do you know?
Uh, they're doing okay. Like I said, mainly I speak to their parents a lot more than I do with my students in terms of this COVID situation and stuff like that. I deal a lot more with my parents, and I assure them that to try to keep them as safe as possible. Uh, as far in terms of the connectivity and the classes and the assignments that are provided for or that are given to my students, I tell them that they have all the time to complete the assignments. Part of my classroom is not so much on doing the grading and stuff like that. It's more on observations. When we're at the work sites, are they doing this? Are they following directions? Are they doing this? So, you know, but other than that, no, I think we're okay with that.
So was this stressful for you? Did this pandemic bring on like a whole new level of stress with having to deal with in terms of your personal life and your work life, having to try to take care of your family while also trying to work and take care of your students?
I think the most stressful situation, for all this would be trying to find new activities to present to them, to my kids, virtually. I'm having to scour the internet for different activities for them to do, talking with other teachers to see if I could find anything or to give me some examples that I could follow and do for my kids.
So what kind of activities do you give your students? What do you like what are you doing to help them with all?
We talk about scenarios. You're in a restaurant. How do you order? Do you just go and blurt out, "Oh, I want a hamburger," that sort of thing, and how teach them how to read a menu. How to follow the menu. How to say please and thank you while you're at the table. Little things like that that most of us, do on a daily basis.
Do you think the online teaching is easier for you, like in terms of your social skills class, or do you think that it's a little harder?
I am more of a hands-on person. I'm more a traditional teacher. I like the face-to-face instruction for my kids. That's the way I was taught. Uh, that's the way I learned, and that's the way I teach. Uh, my kids.
Do you and your students miss the like how school was before the pandemic?
Oh, definitely, definitely. It's not the same. I love my kids, and they love me. It's we've had that bond, and it's amazing. It's amazing. The minute they see me, out on the streets or at a Walmart or HEB, and they want to run and hug me, but they know they can't. So it's just kind of like from afar.
So can you explain a little bit how your school administration helped its students during the pandemic? Was the administration dependable for them and for you as a teacher?
I would say definitely. I know that our principals has had many parent meetings virtually. Letting the parents know what was going to transpire at our school, how things were going to be done. With the passing of these laptops and hotspots and whatnot, he was very instrumental in doing so. With that in mind, he would give us all that information as well. So when parents would maybe not talk to him directly, but they would call me, and I already knew what I had to say and what was expected. So yeah, no, he was very good about that.
And so, do you think that he was good and helpful, I guess, in terms of like the students who are from poorer backgrounds? Do you think that they were helped?
Definitely, every student in our campus and every student across our our district was given that opportunity to come and pick up a laptop and a hotspot. And like I said, it was up to their parents to come and do so. Some had already laptops and hotspots at home, some didn't, and those that didn't were able to get one. The opportunity was there for everybody.
Do you think that some of the parents are taking it seriously?
As far as my students are concerned, all of my parents take this pandemic very seriously. Like I said, out of the 15 kiddos that I have, only two of them elected to go to class. And mind you, my students are already 18 plus. They're in the age out group, in the age out program. So out of the 15, two of them elected to go back to school. The rest stayed at home virtually. And like I've been in contact with all my parents, and they're very adamant about them staying home and learning virtually.
So as you mentioned that age out program, do you think that it's kind of harder now that because of the pandemic? Do you think that it's harder for all of this kind of on your students in that program?
Oh, definitely. I know that my all of my students are routine oriented. We teach in the morning from 9 to 12:45. At 12:45, we would board a bus to go and work at the different work sites. All that's been broken. We don't do that anymore because of the pandemic. However, I've instructed my students along with their parents to try to mimic that work setting that we had. It's hard to do, but and for some of my students, they're able to do it at home. Try to keep up with that what was being taught in the actual classroom.
And so I kind of want to, I guess, talk about a little bit about the reality of this pandemic teaching, and the special education program, and so the reality of this pandemic and the student teacher parasocial relationship has come to an end in terms of you being able to closely teach and help your students. Did you find that your IEPs having to change in any and what kind of way?
There was a lot of documentation involved during uh, prior to the pandemic, before the pandemic, and now. We have to document a lot. We try to follow the IP to a T as much as possible. Uh, we do have to make changes, and we let the parents know. We have to have an ARD before we do any changes to the IEP and whatnot. But we try to stay true to that IEP as much as possible.
And so, before the pandemic hit, there was the funding for special education in Texas was kind of on the brink of a reform. Did you think that special education needed that reform, or your students and other special needs students were getting the proper help from the state?
Uh, I guess I'm not too sure on the reform. I really don't keep up with all this bureaucratic BS. What I do know is that my kids, whatever I need from our district as far in terms of student needs, whether it's uh, books, whether it's a curriculum, whether it's something for them for the classroom. I know that they would give me without even blinking an eye. They would just say, "Here it is."
So you can say that your students were always kind of taken care of in terms of funding and being given anything that they needed.
Definitely, our special education director is very good about working with our kiddos, and whatever they need, she would try to provide. And she would be the one at the forefront to be cutting all these red tape and stuff like that sometimes is placed on there. But she's very instrumental as well. She's very good about working with our kids and providing for our kids. Uh, you know,
And so how do you feel as like compare in comparison to other special education programs in the country that there a lot of students with special needs are kind of are being ignored because of the pandemic. How does it make you feel knowing that your students are taken care of?
It's unfortunate that we can't really reach every single one of our students in or other parts of the state and stuff. Pero I'm sure that they're taken care of in one way or the other. They may not be as we are, but it just takes the teacher is the one that has to take that initiative and say, you know what, I need this, I need this, I need this. Having proper networking is key to a program like mine.
And so, did you see like other teachers kind of just give up on this whole remote teaching and, like not teach their students or just stop signing on to their classrooms?
No, not in particular. Pretty much all our teachers well, especially the ones in my campus, they're very good about logging in and being able to talk with being able to see their students. Um, like I said, it is difficult. It's difficult for everybody. It's difficult. It's taxing on the students and taxing on the teachers because it's a little harder now. But as far as our teachers are concerned, in my campus, they're spot on. They're right there.
What kind of changes, like in terms of paperwork, happened for you after the pandemic and the remote learning? Were they like much harder to do now compared to when you were on campus?
Yeah, a little bit more. I mean, more so than what was needed to be done. Because we had to do. I can't remember. It's called the notice of action for the implementation of virtual services. And then you have to get documentation and signatures from the parents and whatnot. And so it was just a little bit more paperwork that we had to do, a little extra, but nonetheless, it was still good. It was still good.
So, did you ever feel like your mental health suffered due to the stress and all the new challenges with remote learning? Are you also worried about your students' mental health and how they're doing in terms of the pandemic?
You know what? My students are very resilient. They've learned to adapt and change and just go with the flow. As far as their their mental state is concerned, uh, they're doing okay. They're doing okay. I mean, the only thing that was affected was a routine. So a couple of them had incidents where they just couldn't uh, adjust. But as time went on, they were able to do okay.
How did you feel at the beginning, especially with your students who weren't used to like this routine change? How did it make you as a teacher feel?
It was frustrating at first. Like I said, I still don't like, don't get me wrong, I still don't like teaching remotely. I'd rather do it face to face. Uh, But like I said, we got to do what we got to do. Well, we're here for our kids, and we're here for them. And we just got to do what we got to do.
So we're unfortunately we're close to ending this interview. So I'm going to ask you some final questions. Are you satisfied with the local response to COVID-19 in Rio Grande?
Oh yeah, pretty much. Like I said, our local agencies, our local authorities, and our city authorities, they did really well, in response to this COVID situation. We had the shelter in place that we all followed. We had the curfews that were followed as well. Like I said, it all boils down to individual persons, whether they want to follow that or not. It's up to them. Like I said, you can lead a horse to water, but you can't make them drink. It's up to the person.
So are you satisfied with the state response to COVID-19 led by Greg Abbott, especially in terms of him opening Texas up and not having to wear your face mask anymore?
I think, and this is just my opinion, that we opened the state too soon. Even though we have these vaccines in place and whatnot, but I think that Greg Abbott opened the state too soon. And as far as the mandate for not to wear the mask, I think all of us should wear it. I mean, that's just key. That is just key to keep us safe.
Are you scared with about, especially like about the thought of going into the store or going anywhere and seeing people without their face masks? Does the possibility of that happening, does it scare you?
Here in our area, people are pretty much okay with wearing the mask. I think it's going to still be in place. I know that Walmart and HEB do require you to wear a mask, so we're okay with that. Um, but it is what it is. It's up to the person.
Do you feel like this is the Texas state response? Do you feel like it's a kind of a Republican Party idea, and that they did help push this opening up of Texas and not having to wear the face mask, because we know how they feel about the wearing your face mask and how it's against their liberty or whatever.
You know what? I don't know whether it's a Republican or a Democrat thing, but I do know that if you wear your mask, whether it's in the work setting or whether it's in public places, this is what's going to keep you safe. Because remember, the vaccine is 98% effective or 96% effective, regardless of which one you have, or the Johnson and Johnson. You still can get sick whether you have that vaccine. It doesn't matter. You can still get sick, and that's what people need to be aware of.
Are you satisfied with the current national response to COVID-19 led by President Biden and his administration, as compared to how our ex-president Donald Trump and his administration were handling the pandemic?
I think that the current president, is a little bit more in tune with what's going on with this COVID situation. He's a little bit more aware. Uh, as far as am I satisfied? I really can't say until we figure out where this whole thing is going to go.
So do you at least feel a little bit safer because, President Biden is kind of handling it to the best of his ability, as, compared to when the pandemic did happen, we had a president who was kind of who was acting and telling his followers that, this pandemic wasn't a big deal and just do whatever you want. How does it make you feel knowing that you now have a president and someone who's actively trying to handle this pandemic?
It's all good. I mean, he's trying his best and he's doing what he can for the nation. So, you know, like I said, we just have to follow all these things that are in place for us. We don't do that. If we let our guard down, of course we're gonna have spikes. But just doing what we do, I think we'll be safe.
So, let's say like if you had the power to respond to COVID-19 in regards to the policies, the laws, or workplace decisions, what would you do differently compared to the how it was at the beginning of the pandemic, if anything?
Well, I think I just follow with the same policies that are in place at this point in time. I mean, because obviously they are working, you know. But again, it has to go with the power lies with the individual. That's the bottom line.
Yeah, and we gotta worry about the other individuals who aren't prepared or want to handle the pandemic properly. So my final question to you is, are there any other stories or experiences you would like to share with me that I haven't asked you about?
None that I can think of. I mean, we pretty much covered everything. These were some tough questions uh, that were given to me, but or that were asked of me. Not much. I mean, everything's good. We're doing all right. We're keeping safe, staying strong. That's what it's all about.
So I wanted to thank you, Mr. Saenz, for taking the time out of your day and wanting to share your story with the UTRG Voces Oral History Project. And thank you for talking about your experience and everything that's happened to you. And I wanted to tell you to protect yourself in these times and your family also. And, thank you for your help.
Thank you for having me, and thank you giving me this opportunity to answer some of your questions. Um, and stay safe, and we'll see you next time.
Thank you for allowing me to interview you. And, you two and your family should also hope that all of you are safe with everything. Thank you.
Thank you, and to you as well. Keep safe.